shining a light on the issue of domestic violence.
The United Nations study out this week finds domestic violence is one of the most common killers of women around the world.
Fears are growing at domestic violence shelters. Domestic violence experts in our top story.
Well, a domestic violence situation quickly turned into an assault.
The federal government calls it a pervasive problem that frequently goes undetected.
We're talking about the courage that it takes to come forward as a victim.
Hey everyone, it is July. We haven't done a Community Voices episode in a couple weeks. And so it's great that we have a fantastic episode for you with Holly Harris. She works for Deschutes County. And a little more about her. She is the program manager for Deschutes County Health Services. She oversees all crisis services, including the Deschutes County Stabilization Center. So we spent a good amount of time talking about that because it just opened last month. It's been in the works for 5.5 years, I think she says. So it's a fantastic insight that she has into what she says, the intersection of criminal justice system and behavioral health. She has great things to say about how innovative Deschutes County is in this regard. And yeah, I've just really enjoyed it. So I think you will too. Couple things about just mental health, just to keep in mind. We mentioned a couple of these stats, but this is from NAMI, National Alliance on Mental Illness. 1 in 5 adults in the U.S. experience mental illness. 1 in 25 experience serious mental illness. 19% of U.S. adults with mental illness also have a substance use disorder. So just some stats to kind of wrap your mind around. This one's also probably pertinent. 1 in 8 of all visits to U.S. emergency departments are related to mental and substance abuse disorders. So in my background, the nonprofits I've worked for, I've seen this firsthand, just what can be a revolving door of someone who's really unable in their current state to take care of themselves. And who are you going to call? The police. I won't spoil anything. I just want to go into our conversation, but hear it for yourself. Without further ado, Holly Harris.
Hello, and welcome to the Deschutes County Stabilization Center. The Stabilization Center serves children and adults who are in need of mental health crisis supports and stabilization. We welcome individuals to walk in who are experiencing a mental health crisis, or they can be referred by law enforcement or other community partners. Most individuals who come to the Stabilization Center receive a crisis assessment in one of our 5 intake rooms. The purpose of this is to assess for risk and determine each individual's needs. We offer connection to additional community resources as well as appointments for ongoing mental health treatment and medication when appropriate. An additional service we offer for those who qualify is Adult Crisis Respite. This is a voluntary 5-recliner short-term respite unit for adults experiencing a mental health crisis. This area provides a quiet and peaceful environment for individuals to stabilize and get connected to the appropriate community resources. To qualify for short-term respite, a crisis assessment is conducted and a determination will be made for admission to respite. If the clinician and the individual determine additional time is needed to stabilize, they may be admitted to the respite unit if the following criteria are met. The person is voluntary and willing to participate in the admission process. They are in need of mental health services and not aggressive or assaultive. And they are mobile, able to communicate, and not known to have a major infection or disease in the communicable stage. Other services that are housed at the Stabilization Center include civil commitment investigations, case management, peer support, forensic diversion, mobile crisis assessment team, co-responder program, and crisis walk-in.
I did want to kick us off by reading your "Why are you passionate about what you do" statement. Is that all right?
That is fine.
Good. And then you could jump right in and tie that into your career and your background. So here we go. That's a hard word. The criminalization of mental illness that has happened in this country over the last 60 years is one of the biggest challenges we face as a society. I've been committed to this issue for most of my career and feel strongly we can and must do better. So why don't you provide your backstory, your personal background, and then tee us up to why you feel so passionate about that.
Sure. Yeah. I didn't, going into my career, that's not something that I thought that I was going to necessarily be passionate about. It just evolved over time as I come to understand the issue. I started my career. I knew I always wanted to be a therapist. I wanted to work in mental health, so I knew that much. And then my career just took me in these unique paths. I actually worked at a women's shelter at one point for domestic violence, so I definitely appreciate the mission of Saving Grace and support it wholeheartedly. And then I ended up switching paths a little bit and ending up being the director of a juvenile probation department at a time in Texas when we were really looking to do something different with our youth instead of locking them up in state institutions for pretty minor stuff at the time. And they wanted kind of that mental health background to come in and work with our local department. So that's where it began. I really started to see, particularly with our youth, many of the mental health challenges, behavioral health disorders that were contributing to some of their behaviors and ending them up in this criminal justice dynamic and pattern. And I really started to see it evolve. And I saw their parents also in a similar situation. And so when I moved to Oregon, I got kind of back into the mental health side of things. And I've just really come to appreciate the challenge we're facing and really dug into how we got here as a society. And it kind of began back in the 50s with the deinstitutionalization of mental illness, which was a really good thing. We historically had locked people up in asylums for most of their life, which was not a great way to manage mental illness. And then there was this mass kind of deinstitutionalization that happened. But along with that comes unintended consequences, right? Money didn't follow it like it needed to. It wasn't done necessarily in the most thoughtful way. And people ended up in our communities without the resources they needed. So I've watched this happen even here locally, where in my opinion, Deschutes County does things incredibly well from both the law enforcement side of things as well as the behavioral health side of things, and we still see it. So I think about communities that don't have the resources Deschutes County has, or the progressive approach, and it's even worse in those communities. But it is across the board happening. So these individuals end up in our communities with severe mental illness. And then by no fault of their own, they're ending up getting charged with low-level crimes because there's really no other place for them to go other than our jails. They don't meet criteria for necessarily hospitalization because that's a really, really high bar. And so they're in this gap, but their community members are, not happy with that person kind of being in their space with, maybe committing some of these kind of nuisance crimes, criminal trespass, disorderly conduct. So law enforcement really is left holding the bag, trying to figure out what to do with it. And by no fault of their own, they end up having no choice but to charge them with these crimes and end up in our jails. The bad part about also them ending up in jail for something that's really not their fault. They're born with these mental illnesses, but they end up in jail and they can't participate in the criminal justice process. And so so then they end up in jail, often 2-3 times longer than a person without a mental illness that's in there for those same low-level crimes. And it clogs up our systems. It's a huge drain on resources. It's a travesty for the person that's actually going through it and their family, watching them decompensate in the jail. And so I've just really gotten really passionate about this topic. And I know that we have to do something different and we have to help support our law enforcement so they're not ending up with these terrible choices of, leaving them in the community or taking them to jail.
Yeah. Man, my mind is already racing because before working for Saving Grace, I worked for an organization in California similar to Bethlehem Inn, Shepherd's House. So we had the drug and alcohol recovery. We had homeless shelters and kitchens for daily meals. And so that's how I, cut my teeth on learning firsthand mental illness, but also how did that stem from substance abuse? Did that stem from trauma? And so yeah, I'm having all kinds of flashback memories of individuals that I, connected with and met, and it's definitely not, it's not easy. It's not very cut and dry. It's not fair to law enforcement, like you were referencing at all, to watch them try to navigate such different situations. So in Deschutes County, can you kind of paint a very typical situation?
Yeah. So, Situations that we kind of encounter all the time are individuals with, say, a psychotic disorder. So if somebody with schizophrenia, a schizoaffective disorder, something that's causing them to see things that other people aren't seeing, hear things that other people aren't hearing, and they're acting out bizarrely, as you can imagine. If you were hearing things that other people weren't hearing, you might act bizarrely as well. And so they're acting out in the community and sometimes have a belief that maybe they own a house that isn't theirs. They firmly believe that that is real for them. And so you can imagine the problems that might cause. So they're maybe revisiting this house over and over again because they believe they own it. Law enforcement's obviously getting called out. Can't just let the person, enter a house that's not theirs or be around a house that's not theirs. So what does law enforcement do? Our bar for Oregon to get somebody involuntarily hospitalized against their will is one of the highest in the country, in my opinion. And so unless they're doing something that's truly imminently danger to themselves or someone else, which being around a property that's not yours is not going to meet that criteria, law enforcement can't take you to the hospital. So what do you do? So what's the other option? In Deschutes County, we're fortunate because we have things like a mobile crisis team that can come out and assess and try to divert that person from the criminal justice system. We now have things like the Stabilization Center where law enforcement could voluntarily bring that person over here, and then we would manage that and start working with them. But prior to those things, and in other communities, they would take them to jail, and then it ends up in that process that I just discussed. So we're really fortunate here in Deschutes County because for the last, 15, 16 years, we've had a mobile crisis team. And they actually didn't even become required in Oregon until like 2 years ago. So we've been well ahead of the curve and doing this type of work for a very long time. And because of that, we've really made a dent in the number of people that end up in our jail for strictly mental health related reasons. Still happens from time to time, for sure. But, we really work hard at it and have for a long time. We also are very fortunate in that we have a clinician embedded at the Bend Police Department. We were able to get a grant last year. And the cool thing about that is that person rides in the car with law enforcement officers. So you're not only building relationships and helping understand each other's culture and our work both ways, but you're actually in real time responding to calls so that you get the right people at the scene to really be able to truly divert them from further entering the criminal justice system. Wow. So we have a variety of things in place. In addition, we've been doing what's called CIT training. It's Crisis Intervention Team Training. It's an international model to help train law enforcement how to interact with someone experiencing a mental health disorder differently than, say, they're trained in the academy. You don't come into a situation like that, guns a-blazing, full force. Like, you come into a situation like that very differently. And if you do that, you can really reduce use of force and you can have a better outcome for all. And so we've been doing that training, I think, since about 2012. Wow. And it's a 40-hour training that our law enforcement agencies have committed to sending their officers through. And so I think my point in all this is that it's not a one thing that's going to fix this issue. It is a multi-pronged approach that requires investment and it requires partnerships across a number of agencies to make this type of work successful.
Yeah, absolutely. And it brings up a couple thoughts, couple questions. Luckily I haven't seen anything like this in Bend or in our area, but when my family and I went to Portland for the first time last summer, we were going to Powell's Books and we're at a red light and there's cars, in front of us. We're all stopped. And my wife, gets my attention. Her eyes are really big and she's pointing and there is a man who is touching himself inappropriately. And our 3 children are in the car who are young. And I mean, that would be traumatizing for anyone, to see that in broad daylight. And there's just people walking right by him, and there's cars, everyone's going about their business. And to me, that's such a stain on where we're at right now as a society, because as much as we don't want to just mass institutionalize, I'm curious for your perspective on how in the world does it give that individual any dignity? What is their foundation? What are their resources to not be there doing that? I don't know what the rest of their day look like or who's already tried to work with them or any of that. And again, I haven't seen anything that extreme here, But where's the balance of you clearly are not able to take care of yourself? This is very undignifying. And here are the resources that won't be forced on you, but are available. Where can that individual find help?
Yeah, that's the tough one right there. That's exactly, and believe me, we do have incidents like that here. We have the same, but maybe just on a little bit smaller. We definitely see the types of cases that they see as well. And I think when I talk about a multi-pronged approach, it's not always just about resources. Sometimes it's about legislative change related to the bar that is set to hospitalize people, because my team in particular sees this so often that things have to get so bad. They have to hurt somebody, hurt themselves, cross that line in order for us to actually, put them in a hospital and force some resources on them or force some help on them. And it's a tricky conversation, because you have organizations like Disability Rights Oregon who do great work and are really there advocating for client rights. And then you have on the other side of things where we are seeing, because we are unable to hospitalize people when we need to, they're ending up in the criminal justice system. And that's not right either. And where's the dignity in all of this for the individual? So in my personal opinion, I feel like there really needs to be a balance. Like we need to be able to hospitalize people when they reach kind of that level you're talking about, of like, out in public at risk for arrest because they're doing something inappropriate. That's, and you have to think about the consequences of arrest on a person's life. It's the same as when somebody without mental illness gets an arrest record. Housing becomes an issue, jobs become an issue, and then it just further pushes them down in society to be able to overcome this. And so I do think there needs to be a look, particularly in Oregon, at and there has been a look. There's a group of people really working towards lowering that bar a little bit. We don't want to I think, with all this stuff, there's always a pendulum swing, right? So the institutionalization of mental illness was really high at one point. A lot of terrible things happened in asylums back in the 40s and 50s.
Right.
We don't want that. But then we don't need the pendulum to swing so far the other way that now we can't get people the help that they need, because that's not right either. So there's a middle ground in there somewhere that we need to get to quickly.
Yeah. That's so good to hear, because it's not just because it feels like you can get stuck in the conversations like about semantics or terminology, and it's like, hey, I'm trying to help this individual who isn't in their right mind and they're walking around barefoot until their feet are bleeding. Like, can we talk about the term homeless later and how that is not dignifying? Like I'm trying to get the homeless person attention and help and a clear mind. So I don't know where I was going with that, but
no, it's so true though. I mean, this is the hardest part of the work that we do on my team is wanting to just help a person, but having this red tape and bureaucracy and larger decisions that aren't really feeling applicable in the moment. We just want to get this person help, and we want to help them before they have to be at a state where it's so far down the line that now they've really destroyed their lives in some ways, either hurt themselves so bad that they're going to have long-lasting permanent damage from some type of something that they've done to themselves or someone else. But our system is not proactive; it's very reactive. And so that's why things like Stabilization Center are critical to communities, and having a resource for officers to be able to come and get support to manage this and have a place for individuals to stay that are sort of in that gray area. They don't meet hospital level criteria. We really don't want them in jail. So where can they come? And we've created a space for that population.
Yeah. Well, let's talk more about that. It's a great segue, because that's the thing in the news that initially, I reached out to you was the opening of the Stabilization Center. So I know that's been a long time in the works, and some backstory on it from the article you sent me from The Source. Calls to Bend Police Department involving people who were allegedly mentally ill increased by 172% from 2010 to 2017. So that's kind of the backstory of the need, right? And so where in that time frame did the Stabilization Center idea come to life?
Yeah, so it actually started about 5.5 years ago. And just so you know, that statistic is now 200% as of 2020. It's gone up 200%. So, so not going down.
Wow.
But yeah, the project really started 5.5 years ago with the sheriff coming. He set an appointment with Health Services, and he walked in and he just sat down with us and said, how can we work together? My jail is quickly becoming a mental health facility.
Wow.
And this, it's not right. We've got to do something different. We've got to work together. And I think that's such a critical point, is that if you don't have that relationship with your law enforcement, you need to get it. Because, that is how a project like this is even possible. The fact that we had a law enforcement agency, or particularly our sheriff, and, actually all of ours, who care enough about this issue to say, look, I'm going to do something different. I'm going to go work with those behavioral health people. Where historically that has not really been how we've operated. We've been over here doing our thing. They're over there doing their thing. But our worlds are colliding at this point, and we have got to do it together. So that project started then, and really, over the 5.5 years we've been working on this, we've done a lot of things. We didn't go into this haphazardly. I personally toured 17 different facilities in 5 different states.
Wow.
I was hoping that we were going to find a place that was or see a model that worked perfectly and just do that. But it doesn't work that way. Unfortunately, these are new, innovative types of projects. They're progressive. So what you're seeing is communities doing them all in a little bit different ways that meet their needs for their community. So I got lots of great ideas about how it could work, but then we came back here and we said, how is this going to work for our community? Where are our gaps? And so it was vetted through a number of stakeholders, and the model we really came up with was that we wanted a 24/7 crisis stabilization center with 23-hour respite, and at some point in the future, a sober station. We felt that model would address a number of gaps that we were seeing in our community. And so we're not totally there yet. And it may be a few years before we get the full scope of things, or even longer, because funding for this project has been a challenge. So we are pretty much in what I call phase 1. We are able to operate 7 days a week until 9. We have money to operate 7 days a week until 9, but because of COVID, we've had to kind of phase into that as well. So starting Monday, we will be 5 days a week until 9, but then hopefully by the fall, be 7 days a week until 9. And then I'm continuing to look for the additional funding to get us to that 24/7 mark. I have a grant application in right now that I'm hoping to hear about Friday. If we get that, it'll be a 2-year time frame of operating 24/7. But again, it's a competitive grant application. It ends in 2 years, and then what?
Yeah.
And so it's, and I'm not even willing to talk about the sober station and the plan for that until I get stable 24/7 funding, because to operate a sober station is another $1 million jump, because you have to have a higher level of medical staffing to support that, and so that people are safe. And so, it's not an easy undertaking, but we've got here. We're here. We're open. We have a building. It's beautiful. It's serving a lot of people already, and we've only been open a month. And so we'll get there. It's just these projects are not easy, because often you're having to look for grant funding and other investments to get these projects off the ground, and that's not always an easy thing to do.
Sure. And I'm just curious, is the sober station, will that allow for, you're talking about medical staff, would that be a medical detox possibility then?
It would not be a medical detox. We have a detox facility in this community in Redmond. We need more capacity, quite frankly, but we do have one, and we keep them very busy. The sober station is a nice idea, because the detoxes, if you think sober stations are expensive, detox facilities are really expensive, because they do actually administer medications and things to help people withdraw safely. We don't want to get into that withdrawal type of space with the sober station. We really want to give people enough space to just sober up, so they don't go to jail and they don't go to the emergency room, just to sober up. And then once they're sober enough, then we have the services here to be able to try to capture that window of opportunity to talk about ongoing treatment services, maybe detox if that's appropriate, whatever the case may be. But that's the thing that's missing in both jails and hospitals, is that they can go there and sober up, but there's not that follow-up and aftercare and support in those places.
Yeah. Okay, good. Thanks for clarifying that. That's good to know that that's at least in Redmond, even if it is needs to be bigger. Do you want to touch on it all? And we could totally skip over it, but I thought it was really interesting. So in that source article you sent me from November of last year, it mentions on a national level, Oregon ranked dead last in a 2018 study by Mental Health America, comparing the state's high prevalence of mental illness with low rates of access to care. But Harris, that's you, believes that locally the community's progressive services for those with severe mental illness may serve as a model for the rest of Oregon. Where's my mind today? So that was alarming. I almost didn't believe it. I went and looked at that site and saw Oregon dead last on the list. Would you like to touch on that at all?
Sure. I mean, I didn't believe it either when I first saw it, because I moved here from Texas, and I honestly, I struggle with the mental health system in Texas and how it operated, at least in my community where I was from. And it may have changed since I moved here 8 years ago, but I thought, wow, Oregon's really progressive. But I think what I was seeing is that Deschutes County is really progressive. And I don't really have enough knowledge or expertise to how it's working in other parts of the state other than to see the statistics. And what I will just say about that is, so much of Oregon is rural, and everywhere in our rural communities, they don't have enough funding or staffing or all of these resources that I talk about here today. These, primarily support Bend. They do support the whole county. We definitely, our mobile team goes out to the whole county, but it also takes my mobile team, 45 minutes to get out to Lapine. Not quite as helpful as when a Bend PD officer calls us and we're there in 10 minutes. So you see those types of disparities happening within our rural communities. And I think that's probably contributing to that number. Also, I know a number of other communities privatized their mental health treatment, and I don't know what impacts that has had. I mean, I think in the Tri-County region, we have Best Care, and our other two communities, they do a really phenomenal job. I don't know if that's the case across the state in terms of the treatment, but I just know what we're doing here in Deschutes County, and the fact that we've had a mobile team for 15, 16 years, the fact that we have an embedded clinician, a co-responder program. We now have a stabilization center that's going to be open 7 days a week till 9. We have a forensic diversion team, which has consistently, since they've begun, they focus on people with serious mental illness and reducing the recidivism for that population. And we've consistently reduced the recidivism by 60% since its inception for the population we've served. So you take all of those things and you talk about being dead last. I don't see it within our programs. And so that just doesn't resonate with me.
I think one of my kids opened the door and now the dog's knocking things over. Sorry if you heard that.
It's good. It's pandemic life right now.
Gosh. Well, that's good to know. I mean, it's the silver lining of if you keep doing the amazing job that you and your team are clearly doing, and Deschutes County is a model, then the Stabilization Center with the mobile crisis team, with the sheriff's department that is a collaborator and a partner, hopefully we can see some real improvements, for those who have mental illness.
Yeah, I just have to believe we will, and we do. We've seen it with each program we've implemented. We see a progress in the right direction, and I just think our relationships here are just so incredible. I can pick up the phone and literally call any one of the police departments, captains, chief, sheriff. I can call them, and we have enough of a relationship that we can talk through when things didn't go the way we all wanted it to go and why, and solve it in the moment and have really honest, transparent conversations about how to do better. And that's not the case in every community. Yeah,
that's excellent. That makes me feel really good. I think we made a good choice moving here 2 years ago. What do you think?
Yep.
Yeah. So one thing that I kind of computed just to help me break it down in my mind is, so the National Alliance on Mental Illness, NAMI, I guess is how you say it, right?
NAMI, but I've heard people say NAMI, so I don't know.
NAMI?
Yep.
1 in 25 adults in the U.S. experience serious mental illness. So I was thinking, okay, if I was at a sold-out show at Le Schwab Amphitheater, post-COVID, that means 320, if I did the math right, 320 people have a serious mental illness. I mean, that's like a huge portion, in a section of like representative of, And it just made me think, like, you know how people talk about, you never know the battle that everyone's facing, that everyone's going through. It's like it's something at Pier 1 or something, a nice little poster with a quote about treating everyone kindly because you don't know what they're going through. And if that stat is all similar to where we are in Central Oregon, I mean, that's a big deal to walk around the community and not realize what people are going through. That was a big tee up to ask this. Our first episode, we talked about the stigma of not knowing how to deal with especially pandemic related stress or unemployment suddenly, or trauma that has been unacknowledged, that's now compounded by COVID and the stress and unemployment. And I know that you mentioned this in your email to me, but how can we further break down, destigmatize the getting mental health services, going to therapy, self-care? What advice do you have? What insight do you have?
Gosh, if I had the magic solution for how to destigmatize mental illness, man, that would be amazing. It is a huge challenge. I mean, I just think we just have to educate kids younger, and in the schools younger, just like of that statistic. It's like 1 in 4 people have maybe not a serious mental illness, like kind of more of a depression, anxiety, right, those types of things. So if you think about that, I mean, it's very likely that someone within your own family will very easily be suffering with some form of mental illness at some point in their life, and we just need to acknowledge that as a society and educate our youth, educate lay people to talk about it openly, to change the language we use to talk about people with mental illness, to not use terms that are derogatory. I still hear that pretty regularly, throughout the community, of just the way we refer to people that are struggling with it. So that type of language continues the stigma. Nobody wants to be called crazy or whatever the other terms that are used. And when we continue to use that language in our society, it really does make a difference. We need to make a conscious effort to change the way we talk about it. And we do that by modeling it for other people and calling people out when they're using language like that and asking them to talk about it differently. That's my personal opinion about where we need to start, because I think we still have a long way to go. And even people who are struggling with their own mental health issues, talking about it in an appropriate way and seeking out help.
Yeah, I think that's so true. And I think for me, I don't know if you're a big fan of this book, The Body Keeps the Score.
Oh.
Have you read this one?
Yeah.
So this was a giant epiphany for me, because it really is a trauma lens. That it's not just, it's like if I had a friend that had some kind of serious situation, but then it's 5 years after that whole thing ended, and you're like, geez, get over it.
Right.
Like, I'm embarrassed and ashamed to say, but that, those are some of the thoughts, like, God, how long has it been? 5-10 years? Like, get over it. But I wanted to read this one part, this one sentence here. It says, trauma interferes with the proper functioning of brain areas that manage and interpret experience. A robust sense of self, one that allows a person to state confidently, this is what I think, this is what I feel, this is what's going on with me, depends on a healthy and dynamic interplay among the areas of the brain. So I think it's so helpful when you think about trauma and how what it does to us, and how it's not just a matter of like willpower, of just forget it, just move on, just get over it. Pandemic cat. So maybe some of that, and even maybe just that one sentence, someone listening or watching this is going to say, oh, that actually makes a ton of sense. And I'm going to call so-and-so and apologize for how I've been really unempathetic or really judgmental about that thing they went through.
It's so true. We do a lot of comparative suffering. I know people who've had it way worse than that, and they're not having as hard a time as you are. And
Totally.
We really, it's as a society that happens across the board. I mean, I think you should do a whole show on trauma-informed care. I don't know if you already have or not, but Elizabeth Fitzgerald, who works for our agency, is phenomenal in this work. But we are doing, as an agency, moving towards trauma-informed care approach, and there's Trauma-Informed Oregon. And this is a whole model of like exactly what you're talking about. Everybody, not everybody, many people in their life have gone through things, and to them and their experience, how has that shaped their brain? How has that shaped their thinking? And how is it shaping kind of the way that they move through life.
Yeah.
And how do we as a society, not judge people and not assume things about people because we're using our own experiences to judge that. So it's a very complex issue, but I'm glad that people are starting to focus on it and talk about it.
Yeah, me too. Well said. So I have a ton more notes taken down, but let's see, it's 12 o'clock. So I would like to hit whatever, what are the what's a lasting message that you want to share with the community? Either, why do we need more funding? Don't my taxes pay funding for the Stabilization Center? Or whatever you want to leave as the lasting thought, go for it.
Yeah, I think we've touched on a lot of it in terms of the stigma associated with it. But there's no shame in walking into the Stabilization Center and receiving help if that's what you need. And we're here. And what we do know is that support, like what we offer at the Stabilization Center and like what we offer in our outpatient behavioral health clinics, it works. You can dramatically see changes in people's life. And quality of life by just seeking that help. And it concerns me. Our suicide rates nationally going up, and our suicide rates in Oregon being what they are, and knowing that treatment actually does work. It's just that barrier of somebody being willing and able to make that step and overcome that stigma associated with it. And so what I would encourage families out there is, again, about the language, the way we choose to talk about this, to make sure your kids and your family members know it's okay to get help for it and that there is help. And the Stabilization Center offers a number of services, but one of the, I think, critical things that we offer to the community is help in navigating the myriad of resources that are out there and kind of knowing which one is appropriate for you to get. We are experts in what is available in our community because that's what we need in order to help people move through their crisis. That's awesome. That's hilarious. No,
the door started closed, so I'm gonna have to get a door lock. Sorry about that.
No problem. That's hilarious. But that it's overwhelming for families. So even if they are okay with seeking out help, the barriers that exist in terms of navigating behavioral health treatment and all that comes insurance and all the nuances that oftentimes cause people to say, forget it. I'm not going to do it. We are here to help with that. We have people that are really experts in that insurance piece and people that are experts in housing resources and food resources and, how to get people set up an organ health plan and all of those things that are going to help somebody be successful in their treatment. Mm-hmm. So for no other reason, you just need help, like figuring all that out. Just that's what we can help do. And there's no shame in that. And there's no stigma in that.
Yeah. Excellent. I appreciate you really nailing that point. I think that's super important. Well, I want to go another hour. Maybe we'll have to do that again, do a part 2 with you and reach out to Elizabeth Fitzgerald and see if she wants to talk about trauma-informed care and kind of living with that trauma-informed lens. Yeah. So, and then I'll, make sure to not have an open door next time.
No worries. Thank you so much for having me. Yeah, it's been great.
This was great. This was really great. And I'll be sure to post your website link. We'll have your promo video on here. People can get a glimpse of the Stabilization Center. And Holly, thank you so much for your time and your expertise. Appreciate it.
Yeah, thank you. So nice talking with you.
Learn more about us at saving-grace.org. Thanks for joining us.